How are you? Welcome to my YouTube channel D&D Pathshala. In this video, we will discuss regarding the drug of the day, Voglibose. So let's get started with our video. So coming to here in the important note, I want to discuss in this video that the drug information provided in this video is just for educational purpose and for providing knowledge. If anyone use this drug without doctor's advice by seeing this video, and if you face any kind of problems by this drug, then it is not our channel fault or responsibility for the person who took the drug. So please be careful. Now coming here, this is the human insulin structure, and this pancreatic beta cell glucose detection is the insulin secretion mechanism and its release. So in the human insulin, there are actually two types of chains. One is chain A and another one is chain B. In chain A, there are 21 amino acids, and in chain B, there are 30 amino acids. And these are the S's are the here, these are the linkages. So this is the human insulin structure. And coming to the secretion and the release of the insulin, this insulin is actually involved in the control of the blood glucose level. So the higher the blood glucose, the increase in the insulin secretion. And this insulin will also be useful in the secretion. Not only the secretion, it will also decrease the blood glucose level. So coming here, the insulin is secreted by the beta islets of Langerhans from the pancreas. So as we can see here in this is GLUT2. The GLUT2 means the glucose transporter 2. This glucose transporter 2 will help in the entry of the glucose. If the blood glucose is high, then the more glucose will also enter. And coming here in the second step, the ATP. So the ATP sensitive potassium channels will be there. So as we know, intracellular potassium concentration will be more when compared with the extracellular potassium concentration. So because of this potassium concentration, intracellular increased potassium concentration, then these will be diffusing out, means the efflux will be more, potassium efflux. So because of the positive potassium efflux loss, the cell nature will become into electronegative. So because of this electronegative cell, the calcium channels will be locked. So by these calcium channels are locked, they will be only open when the cell is depolarized. And these are the insulin type of granules, and the insulin cells will be stored in the form of the secretory vesicles in the form of preformed insulin. So this is the resting phase of the insulin. Now coming here to the good morning phase or to the wake up phase of the insulin secretion. For example, if a person take an energy rich meal, here the glucose will be increased. So from this glucose will enter into the GLUT2. As I have said in the previous point, if the glucose is more, then it will enter more. So by the GLUT2, through the GLUT2 and by this GLUT2, the glucose will enter. So by the entry of the glucose, this metabolism will lead to the production of ATP. If ATP increase, then the ATP sensitive channel will close. That is, the potassium channels will close. And the potassium efflux will decrease. And by the decrease of the potassium efflux, then the potassium will accumulate. So by the accumulation, then the electropositivity will increase. And by the increase of electropositivity, the calcium channels will depolarize. So by the depolarization, the calcium channels will open. So then this calcium will trigger the insulin containing vesicles by the exocytosis process, and then it will release the insulin into the blood. So this is how the insulin is released. Now coming to the secretion, it depends upon how the blood glucose are released. So if the blood glucose is secreted or released in more amount, then the glucose will enter in a more amount to the cell. And after, the process will be high. And by the high process, more insulin will release. If it is low, the low entry of glucose will be there and decreased process. And this is the less type of release of the insulin will occur. So this is the insulin secretion and release. Now we will go to the type 1 diabetes and type 2 diabetes. As we all know, the type 1 diabetes is an autoimmune disease that which our immune system attacks, and type 2 is the metabolic condition. So here in the type 1 diabetes, our own immune system will destroy our own cells, so that the pancreas will not produce any kind of insulin. But in the type 2, the pancreas can no longer produce enough insulin, but the body is resistant, or the body is resistant to it. And the pancreas will be still in a functioning state. So the but is the pancreas will be in a still functioning state, but it can't produce the enough insulin. And in the type 1, there will be no insulin. So because of no insulin presence, the organs will shut down and death may also occur. When compared in type 2, there is still some insulin, at least some insulin produced. So to regain sensitivity, diet and exercises are advised. And there is no prevention of the type 1 except the insulin. So the cause will be also sometimes idiopathic. And when coming to the type 2, the genetics also play a part. That is, this type 2 can be prevented by the healthy lifestyle and by the healthy eating. And coming to the type 1 treatment, insulin injections are the mostly used treatment and they are only the option also. So by the insulin injections and by the constant glucose monitoring. And the risk factors of type 1 may be including the family history who are having it and environmental and genetics. Then compared in type 2, the treatment will be lifestyle changes, diet, exercise and by the diabetic drugs, or if preferred, the insulin is also given. And the risk factors that which include like genetics, lifestyle choices and being overweight. So this is the insulin and these are the oral antibiotic drugs. Now coming to the oral antibiotic drugs, so we are discussing regarding Voglibose, but I will tell you a brief classification regarding the oral antibiotic drugs. So these are divided in 3 major categories. So one is enhanced insulin secretion, second is overcome insulin resistance, and third is miscellaneous drugs. So in the enhanced insulin secretion, we will be having potassium ATP blockers, that is the sulfonylureas and meglitinides are the subclasses. As all of you know, sulfonylureas are like glimepiride, glipizide, gliclazide, and meglitinides are repaglinide, natiglinide, and the DPP4, that is dipeptidyl peptidase 4 inhibitors are the gliptins, sitagliptin, vildagliptin, and linagliptin, saxagliptin. So these are the enhancing insulin secretion subcategories. Now coming to the overcoming the insulin resistance, biguanides like metformin and thiazolidinediones, that is PPAR gamma activators, pioglitazones. So these are the second category. Now coming to the miscellaneous drugs, there are 4 subcategories like alpha glucosidase inhibitors, amylin analogs, dopamine D2 agonist and SGLT2 inhibitors. So amylin analogs are premilitinide, that is premilintide, dopamine D2 are bromocriptin, sodium glucose cotransporter dapagliflozin, that is dapagliflozin. And in alpha glucosidase, so we are discussing the Voglibose drug that which comes under this category. So let's move on to our drug Voglibose. So this is the chemical structure of the Voglibose. So these are the hydrogen atoms and oxygen and the nitrogen atoms that which are arranged. Now coming to the chemistry of the Voglibose, this Voglibose was discovered in the Japan in 1981 year, that which is from the isolation of the validamycin drug on the culture media. That culture media is Streptomyces hygroscopicis var limonons. So from this culture media, the producing organism, the Streptomyces hygroscopicis var limonons, from the validamycin drug, this Voglibose was discovered. But it was actually commercially available for the treatment, commercial available treatment of the diabetes mellitus. It became commercial in Japan since 1994. Now coming to its molecular formula, it is C10H21 and only one atom and O7. So oxygen are 7. Now coming to the IUPAC name. IUPAC name is 1S, 2S, 3R, 4S, 5S, hyphen 5, hyphen 1, 3 dihydroxypropane, 2 ilamino, 1 hydroxymethyl, cyclohexane, 1, 2, 3, 4 tetrol. So this is the IUPAC name. And coming to the molecular weight, 267.28 gram per mole. Now coming to the brands. So I have discussed in the previous slide regarding the chemistry. Now we will discuss regarding the brands. The brands are like from the Life Care company. It is manufactured by the name, by the brand name Legly in the strength 0.2, 0.3 mg, and by the Pfizer Limited Pharmacia India Private Limited Company with the same strength 0.2 and 0.3 mg. The brand name is Alphabose. And by the AstraZeneca company by the same strength 0.2 and 0.3 mg with the brand name Vigosil, tablet Vigosil. and by the Novartis company with the same strength 0.2 and 0.3 mg by the tablet name Vingos. So these are the brands. Now coming to the pharmacological information. This drug belongs to the category oral hypoglycemic agents, alpha glucosidase inhibitors and blood glucose lowering agents. Now we will see what this drug is used for. So these are the uses. It is used for treating the diabetes and also prevents the hypoglycemia in the type 1b glycogen storage disease, and it also decreases the postprandial glucose. The postprandial glucose is the glucose that which is checked after eating, means for around 1 or 2 to 3 hours of eating. And it also decreases the macrovascular complications of diabetes mellitus. So these macrovascular type of complications of the diabetes are like cardiovascular diseases like coronary artery disease and irregular heartbeats like arrhythmias, either it may be tachycardia or bradycardia, and gangrene and sudden death. So these are the uses of the Voglibose which are used to treat and which are used to prevent. And when coming to the available strengths, in India, this new alpha glucosidase inhibitor was launched by the Ranbaxy Laboratories at February 14th in 2006 year. The available strengths are the same 0.2 and 0.3 mg in the oral tablet form. So there are no parenteral forms. And the actual usual dosage is TID, that is 3 times a day before meals, 200 to 300 microgram. When converted to mg, 0.2 and 0.3. Now coming to the mechanism of action. It is a valiolamine derivative, and coming to its mechanism of action, it will be binding and reversibly inhibiting alpha glucosidase. So this alpha glucosidase is a type of enteric enzyme that which is actually found in the small intestine's brush border, that is at the villi and the microvilli fiber border, which is also known as brush border. So this enzyme is being present there. So this Voglibose will bind and reversibly inhibit this enzyme at the small intestines. So this will be enzyme, the alpha glucosidase enzyme, this will be actually doing the function like hydrolyzing the oligosaccharide and disaccharide into the glucose and also into the other monosaccharide. So this is the function of the alpha glucosidase. So this Voglibose will bind and reversibly inhibit. This will not only bind and inhibit, but it also delays the absorption and as well as the digestion of which substances? Dietary polysaccharides, by reversibly inhibiting the carbohydrate digestive enzymes which are like sucrose, maltose and etc. So by the delaying of absorption and by the inhibition, it will result in the decreasing of the postprandial blood glucose. So by decreasing the postprandial blood glucose level, it will be also preventing postprandial or PPB, postprandial hyperglycemia. So that is the mechanism of action. Now coming to the pharmacokinetic information, it is a very slow and a very poor absorbable drug, and only small fraction of doses absorbed. And when coming to its area under concentration AUC value, it is 8.17 microgram per hour per ml. And coming to the Cmax, that is if the drug or the drug that which reaches its maximum effect at maximum concentration. So that is Cmax. And when coming to the Tmax, it is the maximum time that it which reaches its maximum effect. So the Cmax is 1.38 microgram per ml, Tmax is 2.5 hours, and the half-life, that is half of its action or half of the drug is eliminated or it is digested. So that is the half-life. It is 4.08 hours. And coming to the metabolism, it is having a very little metabolism, and when coming to its biochemical test, this drug will increase the hepatic transaminases when if we do a biochemical test. But when coming to the liver damage causing chances, these are very rare. So this is the pharmacokinetic information regarding the Voglibose drug. Now coming to the adverse effects and contraindications. So before discussing regarding the adverse effects and contraindications, mostly the patients will not be suitable for these alpha glucosidase inhibitor drugs because of the gastrointestinal side effects. Like before Voglibose, like acarbose is present. So they are not suitable. But when compared with acarbose and other alpha glucosidase, Voglibose will be showing less side effects type of range. So the Voglibose is also having side effects, but the cause of the side effects chance is less when compared with alpha glucosidase, and the alpha glucosidase inhibitor, the Voglibose drug, is also more potent and it will be showing more action when compared with in the other drug, that is the alpha glucosidase, like acarbose. So this is somewhat effective when compared with acarbose and other alpha glucosidase inhibitor drugs. So now coming to the common and serious adverse effects. Common adverse effects are same, the gastrointestinal: nausea, vomiting, soft stools, bloating, abdominal fullness, diarrhea. And coming to the serious adverse effects, cholestasis, nematosis intestinalis. Nematosis intestinalis means the presence of the gas or the free air in the intestines. It is termed as nematosis intestinalis. And coming to the contraindications. Contraindications are if the patient is having diabetic ketoacidosis or inflammatory bowel disease, that is IBD, hypersensitivity to the Voglibose drug, or if the patient is having gastrointestinal or liver or kidney disorders, they have to tell the physician before that, taking before this drug, they have to tell their health conditions so that the physician will able to know regarding the drug giving or non-giving to the patient. So these are the contraindications. And when coming to the interactions, there are actually some interactions, like if this drug is taken with combination, like with beta blockers, salicylates, MAO inhibitors, fibrates, they can increase the hypoglycemic action. And when coming to the interactions, other type of interactions like epinephrine or thyroid hormones, they can decrease the hypoglycemic action. So these are the interactions that which can cause with the drug, that is the Voglibose. And the pregnancy category of this drug, it is given as B category. That means it can be given to the pregnant woman, but the pregnant woman should take the advice of their physician before taking this drug, and it shouldn't be given to the breastfeeding woman. So these are the adverse effects, contraindications, interactions and pregnancy category of the Voglibose. Now coming to the patient education, we should tell the patient to take the drug regularly, as this drug is having a very low amount of absorption. So this drug should be taken 3 times a day or their direction by their physician. So if they have recommended 2 times or if they have recommended 3 times, so they should take by their physician's advice and they shouldn't miss their dose. And we should also tell, however, we should also tell the patient about the side effects and educate the patient to go to the hospital and also to report the physician and pharmacist if the side effects are not decreased, and if they are increased or if they are not controlled, they should go to the hospital and they should have to report to the physician or to the pharmacist. And we should also tell the patient to take this tablet before food, as its main use is it will decrease the glucose after food. That is, after food taken glucose, it will be decreasing. So it is the main use. So we have to tell the patient to take this tablet before food. And we should also tell the patient that if the patient miss their drug dose, then they should ask their physician or pharmacist that I have missed my Voglibose drug dose, doctor or pharmacist. So what is the further action that which I can do? So we can have to recover the drug dose or we have to leave that day. So they will be telling the patient. So these are the educating points that we should tell to the patient regarding the Voglibose drug. And thank you so much for listening to my presentation. And if you like my video, like, share and comment if you have any doubts regarding the Voglibose drug. And please subscribe to my channel and forward my channel, and please subscribe to my channel and support me. And if you have any kind of doubts regarding this video or any previous videos, comment on me on the comment section below. And thank you.